Hey everybody, welcome back to CoronaChat. It's Caitlin, and tonight is Friday, April 17th, and it's a little windy out here. The first time I recorded this, it was a little hard to hear. You can see my hair is doing all kinds of stuff. So I'm gonna just kind of try to hold the microphone and see if that helps at all. But anyway, tonight we wanted to talk a little bit about recovery, right? So you've been sick with COVID-19 or something that seems like it might be COVID-19, but you have no way of knowing because there are no tests where you live. So how do you know when it's safe for you to interact with the rest of your family and your housemates again? Now, when tests are widespread and available, in other words, you can be tested without having to leave your house or your bed, wherever you're, in isolation, right? The CDC and the World Health Organization are on the same page. If you're feeling better, you need to have a test come back negative, wait 24 hours, take a second test, and then also have that one come back negative. If either one of those tests comes back positive, you need to, keep waiting, stay in isolation, and then repeat this, take the 2 tests when you're starting to feel better. If you are not able to get tested from your room, which is probably the case for most of us, right? Then the guidance that CDC and WHO give are a little bit different. So we're going to walk through kind of the recommendations of each agency one at a time. So CDC says that you have to stay in isolation until you meet 3 conditions. So 1, you've had no fever whatsoever for at least 72 hours. So that's 3 full days and 3 full nights, right? This means no fever without taking Tylenol, any other kind of fever suppressor. You just have to naturally have no fever. So if you've been taking Tylenol to bring your fever down, right, you have to kind of stop taking it to see if your fever picks back up. And once you're not taking anything and you haven't had a fever for 72 hours, that's the first sign. Condition 2, your respiratory symptoms need to be getting better, meaning that your cough, the tightness in your chest, any shortness of breath, all of that stuff needs to be getting better. Again, this is without medication. It's getting better by itself. 3, it must be at least 7 days, 7 full days since you first started feeling sick. And this is important because that fever with COVID-19, like we talked about yesterday, it can be cyclical, right? So you could have a really bad fever on day 1, and then, the fever could go away for a couple of days and then come back. So by waiting at least a week since you first started feeling sick, there's a better chance that, this thing is really out of your system, right? The World Health Organization suggests being a little more cautious, right? So they suggest that you wait until you have had no symptoms for at least 14 days. That's 2 whole weeks to make absolutely sure that you're better, right? So the World Health Organization says this in part because it's easier to tell definitively, right, that you have certainly been feeling 100% better for 2 weeks. Than it is to say like, well, I'm probably feeling better for the last couple of days, but I still feel kind of tired and I don't know if that's all the way better, right? So WHO says, well, the way you know you're definitely better is you've been completely better for 2 weeks. So, a little bit of difference there between kind of what the 2 agencies are saying. But as from the evidence that we have right now, this whole thing that CDC is saying of, wait at least 3 days until this is kind of the set of symptoms, you meet all of these conditions. We think that should work. Obviously, as we learn more, we'll be adjusted. But, if you are more comfortable saying, no, I really want to wait those 14 days that the World Health Organization is saying, that's okay too. So if you had a positive test but didn't develop any symptoms, right, as we're starting to see community-wide testing ramp up, now what do, right? So CDC recommends that you stay in isolation at home for at least 7 days, 7 days and 7 nights after that test, right? So that's after you took the test, not after you received results, because we know sometimes there can be, a bit of a delay there. So if you do not develop any symptoms during that 7-day period, based on what we know right now, CDC says that it's okay for you to interact with the people that you live with and kind of go back to your social distanced version of normal. This is all, of course, like I said, subject to change as we learn more. But if it changes, we'll be sure to tell you about it here on CoronaChat. And now on to your good news for today. It comes to us from Hong Kong. So yesterday, Hong Kong announced that they only had 1 new case of COVID-19. This was kind of after a small peak in the number of cases at the end of March. They've managed to, through April, get that peak to come back, that curve to come back down again. And it really seems like whatever they're doing is working. So policymakers all over the world are studying Hong Kong to figure out what they did and what might be replicable in other parts of the world to help stop the spread of the virus. So once we know more, again, we'll be sure to tell you about it here on CoronaChat. And just wanted to give you a little update. Moving forward, CoronaChat will be moving into a Monday through Friday schedule. Unless, of course, something major happens over the weekend, then we'll be sure to bring you a special, limited edition CoronaChat over the weekend. But mostly we'll be moving to this Monday through Friday schedule. And that's mostly because, just like all the rest of you, the CoronaChat team also occasionally needs a break from the coronavirus news. So we'll be kind of rotating that into our schedule. But we will see you back on Monday. And until then, stay safe and take care of one another. Bye.